You are welcome to the masterclass Psychiatry Medicine. Um, I'm Dr. Prosper Tettey in the United Kingdom, and today we'll be touching on the topic drugs treatment in pregnancy and breastfeeding. I'll give an outline. It's very useful, this one, as for students as well as medical students and students in medicine and even practicing junior doctors, um, those preparing for exams, to give you a feel of what the outline you need, the main points, and you can fill in with more extensive reading. I'll also refer you to the playlist, which is the masterclass playlist, to get the previous presentations on various topics in psychiatry and medicine. So here we go. Today we'll be covering the following. It looks like a tall list, but I'll be brief on the risk CBT and IPT and antipsychotics ECT, Clozapine, Lithium, antidepressants, Benzodiazepine, not Benzi, Benzodiazepines, and Carbamazepine, Valproate, and the Foetus and Maternal and Baby feed. So the risk of relapse, the severity of the previous episode also points to the risk of relapse of the condition, and stopping drugs may not remove the risk to the fetus, and the risk of stopping abruptly needs to be considered, and the risk in overdose needs to be considered in prescribing for pregnant women with mental health problems. Other alternatives can be looked at in terms of cognitive behavioral therapy, CBT and IPT, interpersonal therapy, and antipsychotics, which I'll expand on. If one is to start, it needs to be a low dose, haloperidol, chlorpromazine, or trifluoperazine. And in severe sleep problems, low dose chlorpromazine or amitriptyline. Other options include ECT in severe cases, rapid tranquilization. One needs medication with short half-life and do not seclude a pregnant woman. And antipsychotics need to know that there are side effects of raised prolactin and reduced fertility with risperidone, amisulpride, and sulpride. Gestational diabetes and weight gain with Clozapine is more, and agranulocytosis with Clozapine. EPSC, extrapyramidal side effects with depot medication. Now, lithium has effect on the fetal heart defects in the first trimester, and the incidence is 8 to 60 in 1,000. And Epstein's anomaly is in particular, and the incidence is from 1 to 10 in 20,000 in the first trimester. And lithium enters the breast milk at high levels. So if lithium is to be continued, keep the serum level low and monitor. For antidepressants, start with the lowest dose. There are risks involved with amitriptyline, nortriptyline, imipramine, but worse in overdose. Fluoxetine is the best SSRI in pregnancy. The fetal heart defects occur associated with paroxetine in the first trimester, and breast milk needs to be considered, and it's less in imipramine, sertraline, and nortriptyline. The levels are less in breast milk. For benzodiazepines, there is fetal malformation, cleft palate, floppy baby syndrome in the neonate. For carbamazepine, there are neural tube defects, incidence of 8 to 50 in 10,000 pregnancies. Oral cleft problems with lamotrigine, and the incidence is 9 in 1,000 pregnancies. Lamotrigine also has dermatology problems if baby is breastfeeding. Valproate has side effects of neural tube defect in the fetus and spina bifida, which is serious, and anencephaly, small brain. There's also increase in this risk from 6 to 200 in 10,000 pregnancies. For the fetus, confirm always pregnancy, and screening and counseling on additional monitoring is necessary. Pediatric assessment needs to monitor the newborn, and for floppy baby syndrome, look for signs of irritability, crying constantly, shivering, restless, tremor, tone increasing, feeding problems, sleep problems, and rarely seizures. Now, treatment of maternal illness is the highest priority in pregnancy. It is inappropriate to withhold treatment to allow breastfeeding. Time feeds to avoid peak drug levels in milk is an option, or express milk to give later to the baby. Thank you very much for your attention. I hope you enjoyed this, and you can all be invited. You are to subscribe and also to share this with others on my YouTube. I wish you all the best in your career and the best in your exams. Bye.